Over the past half-century, patients have increasingly challenged the expertise of their physicians. Providing patients with data and advice has become inadequate for disseminating information and promoting informed consent. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Barron Lerner, a professor in the departments of medicine and population health at New York University Grossman School of Medicine. Dr. Lerner has written a perspective article about medical expertise as part of the journal's series on the fundamentals of medical ethics. Dr. Lerner, at what point in history and for what reasons did physicians initially begin to benefit from trust in their expertise and authority?
I would say the huge rise in physician authority and trust occurred in the late 19th and early 20th centuries. That's when the germ theory of disease became established and various technological innovations came into medical practice, things like vaccinations and antibiotics. And all of a sudden, doctors could really accomplish a lot for patients who had various diseases. Prior to that, there were some effective treatments, but not a lot, and patients often chose to stay away from doctors and hospitals. But the big change really comes when you've got scientifically proven interventions that can truly help patients and get them better.
And then, as you explain in your article, social movements began confronting the medical field and rejecting medical expertise in the 1970s. So, what were those movements pushing back against, and in what ways did the medical field undermine its own authority?
The social movements I was referring to outside of medicine would be things like the civil rights movement, anti-Vietnam War protests, and second wave feminism. And if you think about all those social movements, they all challenged people in positions of authority, whether it was men, whether it was soldiers, whether it was white people, and said, you need to do better. And that is the exact sort of change that happened in medicine. It would make sense that patients, research subjects, and other activists began to look more closely at doctors and the practice of medicine. And what they often found, much to their dismay, were things that weren't very good. Treatments that were done based on not enough scientific evidence, evidence of coercion to be in research trials, and most ominously, instances where there was sexism and racism done by the medical profession to its own very own patients and human research subjects.
And then, more recently, what's been the effect of the internet's empowering patients and promoting access to both information and misinformation?
Well, the internet changed pretty much everything. I think any practicing doctor knows that these days, for good and for bad. Let's start with the good. The good is I'm all for empowered patients being involved in their medical care. I think the days of paternalism, when patients went passively into doctors' offices and just took their information and did what they were told, is gone, and that's for good reason. It's good to have patients who are engaged, who want patient autonomy. And one way to do that is to learn about your diseases, and the internet can be a very good way to do that. So I am glad when patients come in and challenge me and say, I read this on the internet. What do you think about it? And oftentimes there's stuff that I don't even know about that I can look into. That's the good. The bad is the flip side, which is what is on the internet is of unbelievably variable quality. And so for every good article that's written that suggests something, there might be 5 or 10 even that portray things that are not true or very speculative or downright unfair to doctors and medical practice. So I think most patients know that, but it's hard to sift through it. And certainly patients who are very sick or very desperate will understandably latch on to things they read online, even if they're not true.
And then, how did challenges to the medical profession's authority affect the response to COVID-19 and the public health measures that were taken at that point?
COVID was really interesting. Even as someone, as a historian who's looked at the doctor-patient relationship over time and public health interventions, I was surprised at the degree to which seemingly reasonable measures certainly at the beginning of the COVID pandemic were questioned right away, were rejected. I think public health officials were surprised. This exact sorts of suggestions that had been made for past epidemics like masking and separating people, closing schools, staying home. There was no grace period almost in which all of those things got accepted, at least for a little while. And from the very beginning, people were challenging the authority of doctors to say this and the validity of what they were saying. And I think that built on what we were talking about before, that there has been this growing suspicion of things that doctors have done, and the medical profession has sort of fallen off its pedestal. And when COVID came in, that was often the response that occurred, a skepticism, a mistrust, as opposed to saying, oh my God, there's a terrible pandemic here. We'll do whatever the public health officials say. So it really turned things on its head.
So finally, COVID taught us that the usual response to a crisis, providing the best scientific information, was no longer adequate. What steps can physicians take to better understand their patients' values and connect with them in a way that could help restore the trust that we need?
There's a number of types of things I think that doctors can do. And I urge people to take a look at my perspective because I'm not an expert on this type of intervention. But people are talking about things like trust, things like values, things that don't necessarily get talked about in doctor-patient interactions. So as you alluded to, in the old days, it was, what's the science tell me, doctor? And I'm going to do what you tell me because you're an expert and you're an expert in the science. But now I think we need to talk to patients better. We need to understand what it is that influences their decisions, whether or not they're decisions that we disagree with or even agree with. What is it that patients bring to their medical encounters? What are their values? What things are important to them? So this means oftentimes asking very broad questions instead of narrow questions. Things like, are there past instances in which you thought doctors may have violated your trust? What are positive things about your life that you value that medicine can participate in? Do you have particular religious or moral opinions about the type of medical care that you get? Those sort of very broad questions, non-judgmental. And I think that this can open up much better channel of communication between doctors and patients all the time, but particularly when we're discussing things like the COVID vaccine, other sort of early or experimental interventions that are not proven, that are new, and just step back and try to have a dialogue about what's important. What are the values? And in that way, I think we can gain back some of the trust that we've lost.
Thank you, Dr. Lerner.